Question number 3, the Honourable Annette King.
Thank you, Mr Speaker. My question is to the Minister of Health. If government health expenditure has not kept up with all inflationary pressures, as he admitted on the 29th of July, what impact has this shortfall had on patients?
Speaker,
the Honourable Dr Jonathan Coleman.
Mr Speaker, the central premise of the member's question is wrong. Inflation is currently 0.3%. Cost pressure funding for 2015-16 for health is around 0.6%. Extra investment of over $4 billion under this government is delivering free GP visits for under 13s, 50,000 more operations, 60,000 more first specialist assessments, and 5,500 more doctors and nurses. It's only a national government that can both handle the country's finances and deliver more services.
Supplementary question, Mr Speaker.
Supplementary question, the Honourable Annette King.
Can he explain why, after his claims of all that extra spending in health, we have failing emergency departments unable to treat the number of patients arriving seeking help, with many of them sitting or lying in corridors with or without fluorescent lights because the hospitals are running to capacity?
The Honourable Dr Jonathan Coleman.
No, Mr Speaker, that's totally incorrect. The member's having flashbacks to her own tenure. What she knows is that 95% of patients are in and out of our EDs within 6 hours. The service is much, much better than it was a whole decade ago, back when Mrs King was the minister. And I'm really surprised she's got the gall to get up and ask that sort of question, but she can continue to do so.
Supplementary
question, the Honourable Annette King.
Would his answers about how much money he's put into the health system be much comfort to Mary, who reported on the 11th of August 2015 that she sat for hours with a severe leg infection, unable to get a bed in the emergency department, while 5 other people sat beside her with IV drips in their arms, waiting to get out of the corridor?
The Honourable Dr Jonathan Coleman.
Well, Mr Speaker, that sounds more like August the 15th, 2005, not 2015. But look, as Mrs King has said before, it's better to help patients rather than use them. And I'm very pleased to see that Mrs King's views on the health system have changed substantially over time, because back in 2002, she said New Zealand's not rich enough to have the kind of health system found in Australia. Yet only last week she's saying...
Order. The answer's now almost as long as the question. Supplementary question, the Honourable
Thank you, Mr Speaker. Is it acceptable for him, for a person with renal colic, to sit in a jam-packed corridor outside the emergency department on a chair for hours because there were no beds available, so overcrowded in the corridor that the doctors and nurses were bumping into each other and had difficulty taking blood from the patient?
Well,
Mr. Speaker, Dr. Jonathan Coleman.
You'll notice Mrs King gives no names, no dates, no hospital. I don't think you could possibly believe that. I think it's probably fiction.
Supplementary question.
Supplementary question, the Honourable Annette King.
Does the minister realise that rather than constantly dodging direct questions, failing to give direct answers, and then harking back with selected figures 10 years ago, Mr Speaker, that he needs to focus on what's happening in emergency department corridors today, which, according to a member of Parliament, described, wait till I tell him what they said, it makes them look like some sort of makeshift refugee camps?
The Honourable Dr Jonathan Coleman.
Mr Speaker, yeah, this is all scaremongering and rumour. The member gives no details. The only facts we know is she doubled the budget, delivered 7,500 fewer appointments and 2,000 fewer operations. As I said in the Dawn Post in September 2005, how can a minister spend so much money yet make the system worse? And that was Annette King. No record to stand on, I'm afraid.
Speaker.
Point of order, the Honourable Annette King.
Mr Speaker. Although this is unusual, the minister did say that who was that
order,
that
I just want
from.
The point of order.
I'd like to table Hansard, March the 6th, 2008.
Order, no.
That quote
order,
was
the member will immediately resume his seat. There is no need to table Hansard's in this House. Supplementary question, the Honourable Annette King.
When he railed against people waiting in corridors under the previous government when hospitals were capacity, calling it unacceptable and a failure to the health system, did he envisage that he'd be hearing under his watch about a man with cancer who waited for hours in the ambulance bay beside the emergency department without a pillow or a blanket?
The Honourable Dr. Jonathan Coleman.
If all this was true, Mrs. King would be giving names, naming hospitals and giving dates. I believe she's just making it up. And frankly, you've got no credibility unless you give details. It's better to help patients rather than use them, Mrs. King.
Supplementary question, Mr. Speaker.
Order. Supplementary question, the Honourable Annette King.
Is he aware the increase in those getting a first specialist assessment since 2008-9 averages out of an increase of just 3.8% a year, which Professor Phil Bagshaw, who knows a thing about people waiting in pain and disability, described as absolutely inadequate and reflects the $1.7 billion missing from the health budget under this government?
The Honourable Dr. Jonathan Coleman.
Mr. Speaker, the only fact in all this is that Mrs. King doubled the budget twice and actually delivered 7,500 fewer appointments, 2,000 fewer operations. All the rest is Mrs. King making it up. And if it wasn't made up, she'd be citing names, dates, hospitals. She
Point of
can't
order,
do
Mr.
it.
Speaker.
Point of order.
Mr. Speaker, I did cite a name, and that was Professor Bagshaw. Can I seek leave?
That's not a point of order, but I'll have the point of order if you're getting to it.
Yes. Can I seek leave to table where I got the quote, direct quote from? It is from a newspaper, but Dr. Bradshaw said Bagshaw
Order.
said...
Member will resume her seat. We're not about to table newspaper articles in this House. Question number 4. Order. Order. Question number 4, John O'Naylor.
Thank you, Mr.